Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
A client with acute mania fails to respond to a nurse's interventions to decrease his agitation. The nurse has attempted to defuse the client's anger, but the client refuses to participate in interventions that would lower anxiety. Which action should the nurse take next? 1. Seclude the client. 2. Restrain the client. 3. Medicate the client. 4. Control the client. The correct answer is 3. The nurse should medicate the client who does not respond to verbal interventions and whose anxiety is escalating. This will reduce the client's anxiety and agitation and prevent harm or injury to the client and others. Seclusion, restraint, and controlling the client are a last resort and require a primary healthcare provider prescription and close assessment for when the prescriptions can be discontinued. A healthcare provider has prescribed valproic acid for a client with bipolar disorder who has achieved limited success with lithium carbonate. The nurse should instruct the client about which of the following? 1. Follow-up blood tests are necessary while on this medication. 2. The extended release tablet can be crushed if necessary for ease of swallowing. 3. Tachycardia and upset stomach are common side effects. 4. Consumption of a moderate amount of alcohol is safe if the medication is taken in the morning. The correct answer is 1. Valproic acid can cause hepatotoxicity, so regular liver function tests are needed. Other side effects include nausea and drowsiness. Extended release tablets should not be split or crushed. Doing so changes their absorption. Alcohol should never be mixed with this medication. There will be medication in the client's body at all times. While caring for a 24-year-old preemie gravida client scheduled for emergency surgery because of a probable ectopic pregnancy, the nurse should 1. Prepare to witness and inform consent for surgery. 2. Assess the client for massive external bleeding. 3. Explain that the fallopian tube can be salvaged. 4. Monitor the client for uterine contractions. The correct answer is 1. The client may need surgery to remove a ruptured fallopian tube where the pregnancy has occurred, and the nurse is usually responsible for witnessing the signature on informed consent. Typically, if bleeding is occurring, it is internal, and there is only scant vaginal bleeding with no discoloration. The nurse cannot determine whether the fallopian tube can be salvaged. This can be accomplished only during surgery. If the tube has ruptured, it must be removed. If the tube has not ruptured, a linear salpingostomy may be done to salvage the tube for future pregnancies. With an ectopic pregnancy, although the client is experiencing abdominal pain, she is not having uterine contractions. A dilatation and curettage is scheduled for a preemie gravida client admitted to the hospital at 10 weeks gestation with abdominal cramping, bright red vaginal spotting, and passage of some of the product of conception. The nurse should assess the client further for the expression of which of the following feelings? 1. Ambivalence. 2. Anxiety. 3. Fear. 4. Guilt. The correct answer is 4. With a spontaneous abortion, many clients and their partners feel an acute sense of loss. Their grieving commonly includes feelings of guilt, which may be expressed as wondering whether the woman could have done something to prevent the loss. Anger, sadness, and disappointment are also common emotions after a pregnancy loss. Ambivalence, anxiety, and fear are not common emotions after a spontaneous abortion. A woman with asthma controlled through consistent use of medication is now pregnant for the first time. Which of the following client statements concerning asthma during pregnancy indicates the need for further instruction? 1. I need to continue taking my asthma medication as prescribed. 2. It is my goal to prevent or limit asthma attacks. 3. During an asthma attack, oxygen needs to continue to be high for mother and fetus. 4. Bronchodilators should be used only when necessary because of the risk they present to the fetus. The correct answer is 4. Asthma medications and bronchodilators should be continued during pregnancy as prescribed before the pregnancy began. The medications do not cause harm to the mother or fetus. Regular use of asthma medication will usually prevent asthma attacks. Prevention and limitation of an asthma attack is the goal of care for a client who is or is not pregnant and is the appropriate care strategy. During an asthma attack, oxygen needs continue as with any pregnant client, but the airways are edematous, decreasing perfusion. Asthma exacerbations during pregnancy may occur as a result of infrequent use of medication rather than as a result of the pregnancy. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After teaching the parents of an 18-month-old who was treated for a foreign body obstruction about the 3 cardinal signs indicative of choking, the nurse determines that the teaching has been successful when the parents state that a child is choking when he or she cannot speak, turns blue, and does which of the following? 1. Vomits. 2. Gasps. 3. Gags. 4. Collapses. The correct answer is 4. The 3 cardinal signs indicating that a child is truly choking and requires immediate life-saving interventions include inability to speak, blue color, and collapse. Vomiting does not occur while a child is unable to breathe. Once the object is dislodged, however, vomiting may occur. Gasping, a sudden intake of air, indicates that the child is still able to inhale. When a child is choking, air is not being exchanged, so gagging will not occur. An adolescent female is prescribed amoxicillin, Amoxil, for an ear infection. The nurse should teach the adolescent about the risks associated with her concurrent use of 1. Antacids. 2. Oral contraceptives. 3. Multiple vitamins. 4. Protein shakes. The correct answer is 2. When a person is taking amoxicillin as well as an oral contraceptive, it renders the contraceptive less effective. Because pregnancy can occur in such a situation, the nurse should advise the client to use additional means of birth control during the time she is taking the antibiotic. There are no risks associated with the concurrent use of amoxicillin and antacids, vitamins, or protein shakes. The nurse is inspecting the child's throat. The nurse should 1. Remove the tongue blade from the child's hands after he has experienced what it feels like in his mouth. 2. Ask the child to hold the tongue blade with both hands in his lap while the nurse uses another tongue blade. 3. Have the parent hold the child with arms restrained. 4. Guide the tongue blade while the child is holding it to depress the tongue to visualize the throat. The correct answer is 4. If the child does not stick out his tongue so the nurse can visualize the throat, it is appropriate to use a tongue blade. Having the child participate by holding the tongue blade while the nurse guides it to facilitate visualization of the throat is appropriate technique. It is not useful to remove the tongue blade or have the child hold it, because the nurse will need to use the tongue blade to depress the tongue. It is preferable to engage the child's cooperation before asking the parent to restrain the child. The nurse administers 2 325 milligrams aspirin every 4 hours to a client with pneumonia. The nurse should evaluate the outcome of administering the drug by assessing which of the following? Select all that apply. 1. Decrease pain when breathing. 2. Prolonged clotting time. 3. Decreased temperature. 4. Decreased respiratory rate. 5. Increased ability to expectorate secretions. The correct answers are 1 and 3. Aspirin is administered to clients with pneumonia because it is an analgesic that helps control chest discomfort and an antipyretic that helps reduce fever. Aspirin has an anticoagulant effect, but that is not the reason for prescribing it for a client with pneumonia, and the use of the drug will be short-term. Aspirin does not affect the respiratory rate and does not facilitate expectoration of secretions. A client with pneumonia has a temperature of 102.6 degrees Fahrenheit, is diaphoretic, and has a productive cough. The nurse should include which of the following measures in the plan of care? 1. Position changes every 4 hours. 2. Nasotracheal suctioning to clear secretions. 3. Frequent linen changes. 4. Frequent offering of a bedpan. The correct answer is 3. Frequent linen changes are appropriate for this client because of the diaphoresis. Diaphoresis produces general discomfort. The client should be kept dry to promote comfort. Position changes need to be done every 2 hours. Nasotracheal suctioning is not indicated with the client's productive cough. Frequent offering of a bedpan is not indicated by the data provided in this scenario. For the client who is receiving intravenous magnesium sulfate for severe preeclampsia, which the following assessment findings would alert the nurse to suspect hypermagnesemia. 1. Decreased deep tendon reflexes. 2. Cool skin temperature. 3. Rapid pulse rate. 4. Tingling in the toes. The correct answer is 1. Typical signs of hypermagnesemia include decreased deep tendon reflexes, sweating or flushing of the skin, oliguria, decreased respirations, and lethargy progressing to coma as the toxicity increases. The nurse should check the client's patellar, biceps, and radial reflexes regularly during magnesium sulfate therapy. Cool skin temperature may result from peripheral vasodilation, but the opposite, flushing and sweating, are usually seen. A rapid pulse rate commonly occurs in hypomagnesemia. Tingling in the toes may suggest hypocalcemia, not hypermagnesemia. Which of the following home care instructions would be appropriate for a client with a laryngectomy? 1. Perform mouth care every morning and evening. 2. Provide adequate humidity in the home. 3. Maintain a soft, bland diet. 4. Limit physical activity to shoulder and neck exercises. The correct answer is 2. Adequate humidity should be provided in the home to help keep secretions moist. A bedside humidifier is recommended. A high fluid intake is also important to liquefy secretions. Mouth care is important to prevent drying of mucous membranes and should be performed frequently throughout the day, especially before and after meals, to help stimulate appetite. The client may eat any food that can be chewed and swallowed comfortably. The client may resume physical activity as tolerated. A 12-year-old with rheumatic fever has a history of long-term aspirin use, which statement by the client indicates that the nurse should notify the healthcare provider. 1. I hear ringing in my ears. 2. I put lotion on my itchy skin. 3. My stomach hurts after I take that medicine. 4. These pills make me cough. The correct answer is 1. Tinnitus is an adverse effect of prolonged aspirin therapy, and the child should be examined by a healthcare provider for hearing loss. Itchy skin commonly accompanies a rash associated with rheumatic fever, and the nurse can encourage lotion use. The nurse teaches clients to take aspirin with food or milk to avoid abdominal discomfort. The nurse can also address the fact that coughing after ingesting aspirin can be caused by inadequate fluid intake during administration. The nurse is instructing a preeclamptic client about monitoring the movements of her fetus to determine fetal well-being, which statement by the client indicates that she needs further instruction about when to call the healthcare provider concerning fetal movement. 1. If the fetus is becoming less active than before. 2. If it takes longer each day for the fetus to move 10 times. 3. If the fetus stops moving for 12 hours. 4. If the fetus moves more often than 3 times an hour. The correct answer is 4. The fetus is considered well if it moves more often than 3 times in 1 hour. Daily fetal movement counting is part of all high-risk assessments and is a non-invasive, inexpensive method of monitoring fetal well-being. The healthcare provider should be notified if there's a gradual slowing over time of fetal activity, if each day it takes longer for the fetus to move a minimum of 10 times, or if the fetus stops moving for 12 hours or longer. Postoperative nursing management of the client following a radical neck dissection for laryngeal cancer requires 1. Complete bed rest minimizing head movement. 2. Vital signs once a shift. 3. Clear liquid diet started at 48 hours. 4. Frequent suctioning of the laryngectomy tube. The correct answer is 4. The nurse must maintain patency of the airway with frequent suctioning of the laryngectomy tube that can become occluded from secretions, blood, and mucus plugs. Once the client is hemodynamically stable, Getting out of bed should be encouraged to prevent postoperative complications. Vital signs should be monitored more frequently in a postoperative client. A swallow study is done at approximately 5 to 7 days after surgery, prior to starting oral intake. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client is prescribed metoprolol via a meter-dose inhaler, 2 puffs every 4 hours. The nurse instructs the client to report adverse effects. Which of the following are potential adverse effects of metoprolol? 1. Irregular heartbeat. 2. Constipation. 3. Pedal edema. 4. Decreased pulse rate. The correct answer is 1. Irregular heartbeat should be reported promptly to the care provider. Metoprolol may cause irregular heartbeat, tachycardia, or inguinal pain because of its adrenergic effect on beta-adrenergic receptors in the heart. It is not recommended for use in clients with known cardiac disorders. Metoprolol does not cause constipation, pedal edema, or bradycardia. When teaching a preschool-age child how to perform coughing and deep breathing exercises before corrective surgery for tetralogy of Fallot, which of the following teaching and learning principles should the nurse address first? 1. Organizing information to be taught in a logical sequence. 2. Arranging to use actual equipment for demonstrations. 3. Building the teaching on the child's current level of knowledge. 4. Presenting the information in order from simplest to most complex. The correct answer is 3. Before developing any teaching program for a child, the nurse's first step is to assess the child to determine what is already known. Most older preschool children have some understanding of a condition present since birth. However, the child's interest will soon be lost if familiar material is repeated too often. The nurse can then organize the information in a sequence because there are several steps to be demonstrated. These exercises do not require the use of equipment. The nurse should judge the amount and complexity of the information to be provided based on the child's current knowledge and response to teaching. A pulmonary artery catheter is inserted in a client with severe mitral stenosis and regurgitation. The nurse administers furosemide, Lasix, to treat pulmonary congestion and begins a nitroprusside, nipride, drip per physician prescriptions. The nurse notices a sudden drop in the pulmonary artery diastolic pressure and pulmonary artery wedge pressure. The nurse should first assess 1. 12-lead EKG. 2. Blood pressure. 3. Lung sounds. 4. Urine output. The correct answer is 2. The nurse should immediately assess the blood pressure since nipride and Lasix can cause severe hypotension from a decrease in preload and afterload. If the client is hypotensive, the nipride dose should be reduced or discontinued. Urine output should then be monitored to make sure there is adequate renal perfusion. A 12-lead EKG is performed if the client experiences chest pain. A reduction in pulmonary artery pressures should improve the pulmonary congestion and lung sounds. The nurse assesses the respiratory status of a client who is experiencing an exacerbation of chronic obstructive pulmonary disease secondary to an upper respiratory tract infection. Which of the following findings would be expected? 1. Normal breath sounds. 2. Prolonged inspiration. 3. Normal chest movement. 4. Coarse crackles and rhonchi. The correct answer is 4. Exacerbations of COPD are commonly caused by respiratory infections. Coarse crackles and rhonchi will be auscultated as air moves through airways obstructed with secretions. In COPD, breath sounds are diminished because of an enlarged anteroposterior diameter of the chest. Expiration, not inspiration, becomes prolonged. Chest movement is decreased as lungs become overdistended. A client who has been diagnosed with tuberculosis has been placed on drug therapy. The medication regimen includes rifampin. Which of the following instructions should the nurse include in the client's teaching plan related to potential adverse effects of rifampin? Select all that apply. 1. having eye examinations every 6 months. 2. Maintaining follow-up monitoring of liver enzymes. 3. Decreasing protein intake in the diet. 4. Avoiding alcohol intake. 5. The urine may have an orange color. The correct answers are 2, 4, and 5. A potential adverse effect of rifampin is hepatotoxicity. Clients should be instructed to avoid alcohol intake while taking rifampin and keep follow-up appointments for periodic monitoring of liver enzyme levels to detect liver toxicity. Rifampin causes the urine to turn an orange color, and the client should understand that this is normal. It is not necessary to restrict protein intake in the diet or have the eyes examined due to rifampin therapy. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.